All right. Well, I just want to welcome you to the 9 List Health series. And, we're here with Jen Singer, who is here to talk with us to navigate when people are sick, going through heart failure, and for those that are taking a caregiver role during these times. It's an important message that we want to get out there to share with those who are going through this. And I hope that everyone watching is going to find this informational series, pointing them in the right direction on their journey, and obviously following along with you as you continue to make additional books that we need to know about. So before we delve into the just diagnosed guides that you've written on heart failure, how to support someone who's sick, and how to be sick, I'd like to dig into your background. And for those that are going to be tuning in, you're a medical writer, and your work has been used with a number of top hospitals, and you've also been someone who has navigated being a patient and being in hospitals. Can you share a little bit about your background?
Yeah, well, I wasn't always a medical writer. I came into it the hard way by first getting cancer. So when I was 40, I had non-Hodgkin's lymphoma. I had a tumor the size of a softball in my left lung and
Mm,
went through all of that chemo and all of that radiation while my kids were little, made it into remission, and a couple years later changed courses in my career and decided I wanted to write about this to help other patients. So
wow.
for several years I worked for a couple of different major hospitals in New York City, writing patient friendly information about all the things they need to know.
Mm. And what led you to decide to break out and focus on the Just Diagnosed series?
So then I had another diagnosis, and that was in 2020. I got COVID classic, and a couple weeks later, my heart started shutting down. The electrical system started to shut down. It's called a cardiac block. And
Mm,
from that, I wound up with heart failure. It was probably started with the chemo and the radiation that increased my odds of heart failure. And then here I was, 53, with heart failure and a pacemaker. And so I joined online support groups for people with heart failure. And I kept seeing people over and over again saying, are the statistics online right? Am I going to be dead in 5 years?
mm.
And no, those statistics were not right. And I knew that as a medical writer. In fact, when I was diagnosed with heart failure, I Googled heart failure and got something I had written for a hospital.
It was like a previous you letting you know.
Yeah, 2015 Jen was helping to 2020 Jen.
Yeah.
Yeah.
Wow. Well, in heart failure, you provide information on what heart failure is, its stages, and the theories behind why this happens, and pre screenings and tests that are done, and how to talk about your symptoms when you see a doctor. The guide really breaks down what someone with this condition or the caregiver can anticipate. Why did you take this methodical approach?
Because that's how I was trained as a medical writer. That's exactly what we did. We would be given, you're going to write about pediatric cancer,
Hmm.
and then you had to do the research on how it's diagnosed, what the options for treatments are. We had to interview the doctors to find out what that specific hospital did, and then what the
Hmm.
long-term prognosis was. So when I decided to create my own guides, and heart failure is just the first of many, there's going to be a lot of other guides, not all things that I've had.
Right. Okay. You're like,
Hopefully
I just
I'll
want to
run
know.
out of things I've had. But the idea is to give people the real scoop of what they need to know without the medical ease,
Right.
without the scary statistics, and with an insider's view and a little bit of humor and a lot of compassion.
Mm. And in the book, you take us through various vantage points from when you're at the doctor's office and when you're at the hospital and aftercare in terms of symptoms and medication and dietary changes. You even explore that urge to Google something and connecting with message boards, like you said,
Yeah.
and why you need to have a support system. What has been the feedback for people that have been reading this?
So what I say for the Just Diagnosed guides is, when you're diagnosed with something, don't Google it, because you don't have the medical background. You obviously have, you're emotional, you're scared, and so you're going to get all kinds of unfiltered information that I've
Hmm.
waded through for years as a medical writer, and it's going to scare the heck out of you.
Yeah.
So I recommend that people get some sort of filtered information, and that's exactly what this is. It's what you really need to know now that you're just diagnosed.
And then for those, you also focus on how to be sick and you really dig into that. And a big part it seemed to me is when you should choose to decide to go to the hospital, when to see your doctor, the importance of what the best appointment buddy is. What are three of the key things that one should look for if you opt to bring a person with you? And what are three things that you should look for with that might disqualify that person as your appointment buddy?
Yes. So I decided that in addition to the treatment guides, that people needed a book on how to be sick, because we're
Yeah.
taught how to be healthy, but not how to be sick. And so if you bring someone with you, because it's always helpful when you're in an appointment to have another set of ears, even if you're taking notes,
Hmm.
having someone else do that for you is extremely helpful depending on who you bring. So if you bring someone who's really good at taking notes, someone who's really good at listening,
Yeah.
and somebody who really has your back, someone close to you who's really concerned about who you are, that person can come along with you. The person you don't want to bring is the person that you have to take care of, either
Right.
emotionally, or they're the kind of person who inject themselves into your appointment. Maybe they're trying to make the doctor laugh or whatever it is.
Hmm.
It's not helpful to you.
Yeah.
Or they are terrified by what they're hearing.
Hmm.
Those things don't help you. And it doesn't mean they don't love you. It
Yeah.
just means that they're not your appointment buddy.
They're not the right person.
Right.
Um, I love the scripts. That's actually one of my favorite things about that. I think even outside of when you're talking about things like this, sometimes you need a script when you're talking to people so you're not all over the place, and being focused. Why was this important to you to include this, especially when you're talking to these various medical professionals?
Yeah, I have scripts in there for you to call busy doctors' offices. And I actually created my own when
Mm.
I was about to be diagnosed with cancer. I had been misdiagnosed with pneumonia and I was trying to get in to see a pulmonologist. I
Mhm.
was 40, I didn't have a pulmonologist. And you call and it'll be appointments 3 months from now. And
Yeah.
honestly, I would have been dead 3 months from then.
Wow.
So I needed to get in right away. So calling them, I knew I'm going to sound crazy. They don't know who I am. They don't have to take me. So I sat down and wrote out a script so that it was all business. This is what I'm doing. These are the like fire engine words. They're saying possible mass, possible
Mhm.
cancer. And that's what got me in the next day at a pulmonologist. So I
Wow.
wrote up scripts like that you can use when you call even your own doctor's appointment office, because the people who answer the phone are very busy. Get to the point quickly.
Mm. And for those that are admitted to the hospital, you also mentioned that you need to be aware when you're talking about something about what you're feeling, that this could be creating unintended focuses on you that you might not
Yes.
have thought about. Can you share that story? I love that story. I mean, it must have
Yeah.
been terrifying, but
Yeah. My experience when I went into the hospital in 2020, and this was, COVID, no one was allowed in your room. No one was allowed to visit.
yeah.
So I had the room to myself. I had been put onto the cardiology floor,
Mhm.
and I was used to the oncology floor. And on the
Yeah.
oncology floor, nurses come in and ask you what your pain level is, and you
Mhm.
tell them on a scale of 1 to 10, and then they adjust your pain meds accordingly.
Right.
So I thought when the nurse came in on the cardiology floor, this was the game we were playing. How much pain? And I just kind of said, well, it's kind of whatever number I said. And I mean, it felt like a minute. All of a sudden, I was surrounded by 8 medical professionals, like SEAL Team 6 had
Right.
shown up. Because when you say I'm having pain and you're on the cardiology floor, you might be having a heart attack.
Exactly. Yeah. Oh my god. That must have been you must have been like, "Wait, you want my autograph?"
Yeah, it was I realized immediately what was happening. Like, no, 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 no. Let me explain why I said that and go from there.
Another part that I loved was when you talked about the circles of support and
Yeah.
that diagram and identifying who's a part of it and how you're able to disseminate certain kinds of information. Can you share a little bit about that and why is it important to have that?
Yeah, because in this internet age, we tend to overshare. And I'm saying this as somebody who blogged my cancer for goodhousekeeping.com and
Wow.
blogged my experience with heart failure on Facebook.
Mhm.
Still have to be extremely careful with what information you share and with whom.
Yeah.
So you want to keep in the middle of there's circles of support that go out like this.
Yep.
Very middle around you is the people for whom this matters the most, your family, your doctors, and whatnot. And I would recommend that if you have small children, that they have their own circle of support.
Mm.
because you can't share everything with kids, but you do need to share something.
Right.
Then you go out from there to other people who need to know because it affects them, but they don't need to know all the details, like a boss or your kids' soccer coaches, whatever. They just need to know something's happening.
Right.
You go out from there until you get to social media. And that's where you decide, am I going to start a Facebook page? Am I going to share this on my Facebook page? Is it going to be a
Mhm.
private page? Figure all of that out, because if you don't, you will be going to the supermarket and every 5 minutes, someone will be asking you how you feel when you're
Right.
just trying to buy milk.
Yeah. Yeah. Yeah, that yes. Sometimes the oversharing, and especially in that situation, you want to control it as best as you can. And maybe in those circumstances too, are you telling people depending on their circles, and this is not something I want to go here. If you see this person in this circle, this is the only thing you can say. Like, do you also manage it from that perspective?
Yeah, they don't need to know that you're having bone pain that drops you to your knees.
Right.
They don't need to know that at back to school night.
Right.
But your doctor needs to know that, and your sister needs to know that.
Hmm.
Be very careful about who you're sharing this information with.
Mm. And people who are currently a patient and have been patients have a number of lifestyle changes that take place. And you speak on that too. How does someone approach their work, whether they work for themselves or for
Mm.
someone else, when they're navigating, getting back to where they are?
Yeah. So I was when I was diagnosed with cancer, it was the year I also got 4 book deals. And so I was in the middle of writing books. So I
Hmm.
immediately asked for an extension there. I was blogging. I had just started blogging for Good Housekeeping about parenting tweens. It was not supposed to be about cancer.
Right.
And I had luckily had written 6 weeks of them because I just was not feeling well and thought I better get some of these done.
Hmm.
Sort of gave myself a chance. If you are employed by somebody else, that's a conversation you need to sit down and find out what kind of resources they have for you, because
Hmm.
you're not going to be able to work like you did before,
Yeah.
especially if you're having chemo. You're going to feel lousy for the first few days after chemo. You could be having surgery where you're out, down and out for a long time. So you need to bring in everybody who's involved.
Hmm.
But if you're self-employed, also be careful,
Hmm.
because you can outsource things and they don't need to know you're outsourcing things.
Hmm.
But I also wouldn't keep it a huge secret from everyone either, because
Yeah.
then people are going to make it worse than it probably is.
Mm. And in terms of heart conditions, what do you suggest in terms of maintaining health and wellness and nutritional changes that, a person may have to do?
So I was already in really good shape, honestly, when I had heart failure. Despite having had cancer, I was in Sedona with my kids who were in
Mhm.
college at the time, hiking, and one of my kids is the mile holder record holder for
Yep.
Ithaca College. Not that I was
Mhm.
running, but I was keeping up with him. Um, I didn't have to change too much except to not do as much after. However, in heart failure, you tend to take on water. So I have to reduce my sodium intake
Mhm.
and be very, like, no more Mexican food. No, I have to be very careful about how much salt I take in.
Mhm.
Alcohol really does not make me feel good.
Right.
Not advisable. So, I exercise as much as my body will let me do. Um,
Mhm.
but if you haven't done that, make sure that you go to like cardiac rehab, ask for your
Yep.
doctor for cardiac rehab. I did, just so that they could keep track of me and keep me from doing stupid things.
Mm.
Because I used to lift, I used to bench press 75 pounds in the gym,
Yeah.
and I can curl 10 pounds now.
Wow.
You just need someone watching over you to figure out what you can do.
And so is that like a lot of checking in?
Yeah, so with cardiac rehab, the way it was set up is insurance pays for it, and you go 3 times a week, and they hook you up to an EKG while you're
Mhm.
exercising to
Oh,
see if
wow.
any problems are going on. And now I'm done with that part, but I still go once a week and pay $10 out of pocket just to be around the nurses and to get a little exercise, because it's
Mhm.
not worth it for me to join a gym, but at
Right.
least I can do something there.
Wow. And I liked when you talked about energy triage, why was this important to include? And can you tell me a little bit about that for, everyone else that will be tuning in?
This is especially goes to the perfectionists who feel that they need to do everything. You cannot do everything when you're sick. So it's like having a gas tank, and your gas
Yeah.
tank will never be completely full again.
Mm-hmm.
And so you have to decide what you're going to put your energy toward. And so, for instance, with heart failure, right now I feel really good, but it's been a
Mm-hmm.
roller coaster. And on the
Mm-hmm.
days where I don't feel good, the primary thing I need to work because I'm a single mom. I can't even say that, and my kids are grown now. I'm single, and I
Single.
need to pay for this.
Right.
And I was paying for college, so
Mm-hmm.
that was the first thing that I need to do is, okay, what work do I absolutely have to get done? I do not have to clean my toilet. That goes. I can
Yep.
bring in food if
Yep.
cooking make me tired. So you really have to start adjusting where you're putting your energy toward. And if you're feeling better, then put it toward a walk or something like
Mm.
that,
I
and
like that.
instead of cleaning out the closet.
The closet can wait.
Closet can always wait.
Well, each book speaks to caregivers and how they are involved, from the one that's the treatment oriented one for the heart failure at this point, how to be sick, but how to support someone who's sick really focuses on the caregiver as well as those that will be interacting with someone who's sick. I never thought about how, if there's anything I can do,
Mm.
can be problematic versus saying, I'm so sorry this is happening. Tuesday night, I'm bringing over dinner. Why was that important for you to really let people know about how we're conditioned, but how we need to be when we're in these circumstances to better help someone that's a patient?
So everybody wants to help somebody, and we all feel helpless in helping people.
Yeah.
And often we will say, if there's anything I can do, which sounds like it's helpful, but it's actually homework for the patient, because now the patient has to come up with something for you to do
Yeah.
that no one else is doing, that's within the realm of the circles of support that makes sense for what you need to do.
Mm-hmm.
Instead, I recommend that you actually make a specific offer. So I know that you're going to chemo next week. Do you want to ride?
Yeah.
I know that you have a heart condition, you're not feeling well. Would you like me to mow your lawn next weekend? Things like that. And if
Mm-hmm.
you don't know what to do, just send a gift basket or
Mm-hmm.
a gift card to DoorDash or something like that is always appreciated.
I honestly, that part stuck with me because I was like, wow, it's something that we say that we think, oh, but we're giving you a bevy of options. But now thinking about, the circles, your energy triaging, it shouldn't really be for you to have to be like, hold on, Ginny and Jody did this. So what about, like, that would be a lot. And I think that having really active language as opposed to passive is definitely something that you actually trained me on when I read that this weekend, because I've said it
Excellent.
many
That's good to hear.
times and now I understand that it's a little overwhelming to say something like that.
Yes.
Um so you also look at ways that caregivers must make sure that they replenish themselves. Why is it essential for people in this position to also take time for themselves?
So when you're a caregiver, and I'm a caregiver for my mom, she has Parkinson's,
Mm,
you tend to feel, okay, I'm the healthy one, or in my case, healthier, I guess. I should be able to get through this fine. But it's
mm-hmm.
a lot on you. It's a lot on you logistically. It's a lot on you emotionally, especially if we're talking about inside a family, spouses, children helping out. You need a break too.
Right.
And you can't say, well, they're so sick and therefore my needs are not necessary, because that's just going to burn you out and make you sick. And then you're useless to the person who's sick.
Yep.
There needs to be care for the caregivers, and the caregiver is the one who has to take that.
Mm-hmm.
And I would say to patients, make sure you're paying attention to that don't
Mm-hmm.
put too much on them. Try and spread it around a little bit if you can.
Mm. And I would assume that in many cases, there may be a few caregivers that can be involved with the patient. So, is it a good idea that in this case, they communicate with each other in terms of making sure the efforts are aligned, that they're not overwhelming the patient?
Yeah, in fact, one of my neighbors, when I had cancer, we had started construction on the house. We had no kitchen.
Mm-hmm.
And so everybody likes to cook for somebody who's sick, and they wanted to cook for our family. So my neighbor organized it, and didn't just organize it, she made a schedule so that we knew which days we were getting what, and made
Mm-hmm.
sure we didn't get, 4 lasagnas in one week. She was very clear about who was bringing what and when. And then if somebody backed out,
Right.
had some sort of backup, whether that's sending something from a restaurant or something like that.
Wow. And, being someone who's been in this industry from the medical writing perspective and also being someone who's navigated both sides as a patient and a caregiver, what did you learn? And I know obviously you knew all of these things because that's why you created it, but in doing this and literally putting it down and doing it in the flow that you wanted, what did you learn by doing these guides?
I just think that the number one thing that patients need is validation
Mm-hmm.
that what we feel is what we feel. We don't need to be told to be strong and stay positive because that is also homework. And also, then we feel very much othered.
Yeah.
That's saying, well, you have a disease, you just have to be positive and your attitude will fix it, which studies show that is not what happens at all. There's no, your
Mm-hmm.
attitude won't cure cancer. Your attitude can affect your heart, but if you're
Mm.
quashing your true feelings, that will affect your heart.
Yeah.
So to me, it's time to be real about what patients need. And we need to talk about it in language that we can all understand.
And in terms of the future and ongoing efforts, are there guides you're already working on now? And we know that not every guide that comes out means that you had that situation.
Yes. Thankfully, I'm going to run out of diseases. The next one I'm going to do is lymphoma, which I did have. So I'm going to
Yeah.
do lymphomas, but then I'm going to start concentrating on some of the most common ones like breast cancer. I'll probably do a Parkinson's guide. Other what I call oh damn diagnosis when people
Mm-hmm.
hear, oh, she's got that, oh damn. So that in the same way that I did for hospitals, I can supply information, but from an insider's point of view, because I've
Mm-hmm.
had all of the tests and all of the things, even if I haven't had the condition.
Yeah. How long did it take you to come up with the guides?
That is a very good question. I started thinking about it less than a year ago. I just watching the heart failure boards, I thought this is a part of the market that is not being reached. And
Mm-hmm.
so I just started writing, and there's
Wow.
4 of them out already, and there's going to be more. I
Wow.
even
And
have a publisher interested in printing them.
that's what I was just going to ask you. What is the vision? Because I could so see this. I mean, for those who are watching this, they
Yeah,
average between 35 and 44 pages, but so well thought out.
yeah.
And I was like, these have to be in a physical book form.
Yeah, they're gonna as soon as we strike the deal, they're
Mm-hmm.
gonna come out in print form in 2023, and they will be available, on Amazon and in bookstores, and they'll also be available in bulk sales for, let's say, a pharmaceutical company or a
Oh,
healthcare
nice.
company. They want to give them to their patients. These are going
Mm-hmm.
to be available to them.
Wow. And so, for those that are interested in purchasing the Just Diagnosed guides or those who may have questions, how can they reach out to you and get them?
Stop by my website. It's justdxguides.com. You can also see me on Instagram at justdxguides and on Twitter at @jensinger.
Well, this has been amazing. I love, hearing everything. And like I said, I literally took the weekend and read through it and I was like, this is like every word. I said, this is really interesting. I love all the aspects that you have to it and how, like you said, it's conversational, but it's so necessary. And it's also something that you can kind of like bookmark a little bit and come back to when you need it. And it's such a great resource. And to have you here on the 9 List Health series, sharing this with people, I really, really appreciate you taking the time.
It's been my pleasure. Thank you so much, Kimmy.
All right, thank you. And I can't wait to see what the new books are
Me
for
too.
informational purposes, obviously.
Yes, of course.
All right.